Hello, my name is Dr. Bolana Kubadejo of the Institute for Comprehensive Spine Care. I'm the CEO and Chief Surgeon of the Institute, and I'm an orthopedic spine surgeon. And it's my pleasure today to introduce my patient, Donna Holland. She'll be the first of our patients to give a testimonial regarding her care, and we're very excited to present her story today. Welcome, Donna.
Thank you.
All right, so Donna, just give me a brief history of how your symptoms started and what you were experiencing and the treatment you had up until you had your surgery done.
I was working in overseas last year, doing a tour, Asian tour of Dreamgirls, and one of my actresses got hurt. We were in Tokyo, Japan, and she was on stage and she got hurt, and she came trying to get her off the stage. I pulled to my back, trying to get her back to the dressing room, and she ended up in the hospital, and we put the understudy on, and about 3 or 4 days later, she injured herself on stage.
Wow.
And trying to get her back to the dressing room, she was leaning and holding on to me, and I re-injured my back and pulled my back out twice within that week.
Had you had a history of back issues before that?
No.
This was the first time?
Yes.
Okay, well, what's the first thing you felt when you felt that injury?
I felt my whole lower back give a pull the first time,
Okay.
and the second time it was probably 10 times worse, and to the point where I couldn't even hardly move.
Okay. Was the pain just in your back, or did it travel down your legs at the time?
It traveled down into my legs.
Okay, both legs or just one leg?
Pretty much both legs.
Okay.
Yeah.
All right, and
Pretty
then
much
what did
both
you do after
legs.
that treatment-wise?
I continued trying to do the show, and they actually put me on light duty, had other people helping me during the rest of the run of the show in Japan. And then I had to come back here, and we closed down for COVID, and I didn't get any treatment for probably about 3 months, which was, I think, detrimental to my health.
Did you use any medications, anything over the counter during that time?
No, not really. I was, using, yeah, I was using a few of the medications that I did have, and over-the-counter stuff, and it wasn't working.
Any anti-inflammatories? Maybe a leave, ibuprofen, anything like that?
Yeah, I'll leave.
Okay.
I had to wait until the doctor's offices opened back up,
Right.
so I could see someone.
Right.
And that took some time, and I think that was, kind of hindered my back a little bit.
Okay.
I was in severe pain coming back 17 hours on a flight.
That must have been torture.
Torture.
Yeah.
Torture. I couldn't even breathe once I
Wow.
got off the plane. Yeah.
All right, so what was the first kind of official treatment you then had? Like, what's the first doctor that you sought care
I
for?
went to see an orthopedic doctor, and he sent me to pain management.
Okay.
And from there, I treated with pain management. I did everything. I had the epidurals in my back. I had the device implanted to see if it would alleviate the pain.
Spinal cord
Like
stimulator?
the Medtronic, yes.
Okay.
A spinal cord stimulator.
Was that helpful initially? Or?
No, it didn't
Okay.
do anything.
Okay.
I think my back, I was just in too much pain for anything to happen. I had a discectomy.
Okay. Like a little micro discectomy.
Yes,
Okay.
where they tried to shave down part of the disc to
Okay.
get it off of the nerve,
Okay.
and that didn't work. And after the discectomy, I got worse. I just continued to get worse. I wasn't getting better. Epidurals weren't helping.
Right.
And I finally sat down with my doctor, and we spoke about having surgery.
Okay. So pretty much you exhausted all forms of care.
Yes.
You tried everything, nothing helped.
Yes.
And you knew you needed something more.
Yes.
And that's where the surgery came in.
Yes.
Okay.
I think
So-
that was my last alternative.
I mean, that's usually the best sequence. You want to try everything else, and once everything has failed,
Yes.
then that's an indication that you're a candidate for surgery.
Mhm.
So your MRI is very revealing.
Yeah.
So your MRI shows that you had a lot of pressure on your nerves. So you had a lot of pressure on your nerves. So I have a bone model here that kind of shows what I saw in your MRI. So essentially, you had pressure at 3 levels in your spine, and the worst level was between L4 and L5, and you had bulging of the disc that was compressing your nerves. And once the nerves are compressed, that accounts for the pain that travels down your leg. Okay? And you also had some shifting between L4 and L5, and that shifting, which we call anterolisthesis, means you had some instability. Okay? So Once I assessed your MRI, that really gave me a guide as to what you needed done surgically. Okay? So you were a surgical candidate because you had exhausted all forms of treatment and there was nothing else that you could do but have surgery. So then it was my decision to determine exactly what procedure you would need. Okay? So surgically, you had a procedure called an open lumbar laminectomy and fusion. And we did a laminectomy from L3 through L5. Okay? So, and I'll go into some detail here. So surgically what we did is we made a midline incision. We took down the muscles on both sides, exposed these bones called the lamina. Okay? And then I use a device that I love called the Masonics bone scalpel. And I use that to cut your lamina. This joint here is called the percent joint. So I cut your lamina between here and here at all 3 levels. So because you had severe compression at all 3 levels, I needed to open up your canal at all 3 levels. Now, a lot of patients are afraid of surgery. And what kind of concerns did you have about surgery, or what had friends and family told you about surgery?
My concerns were everybody that I knew that had back surgery was pretty much incapacitated after the surgery. They weren't able to work. So my fear and my family's fear was I wasn't going to be able to go on with my life. I wasn't going to be able to work. And I didn't want to just have a sedentary life after that. So I was very fearful of having surgery, and I told the pain specialist that. But I really didn't have a choice.
Right. Because your quality of life was so compromised, something had to be done.
Yes.
Okay.
Yes.
All right.
I knew that probably after 3 months I would have probably been in a wheelchair. My body was twisted up to the left from pain.
Right. So you were at your wit's end.
I was at my wit's
end. You
end.
knew something had to happen.
Yes.
Okay. So my job is to educate my patients about why surgery is safe. So surgery was different in the past. The complication rates were a little higher. Technology was different. Now surgery is much safer and patients do very well. And your story is evident of that. And I'll give you some detail anatomically as to why surgery is safe. So the spinal cord, interestingly, ends somewhere around L1. So the lumbar spine has 5 levels, but the spinal cord itself ends around L1. Okay. Below L1, we have what's called the cauda. Okay, the cauda equina. So down here, all you have is the dural sac in the middle and all these individual nerves. So essentially, since we're not manipulating the cord, where your problem was between L3 and L5, getting paralyzed was not even a concern. Okay. Now the other point I like to make for my patients as to why surgery is safe, with the technique that I use personally, and many surgeons do as well, I make my cuts lateral to where the dura ends. Okay, so the dura is contained between the lamina, but it's only contained within a certain portion of that. I make my cuts with the bone scalpel lateral to the dura on both sides. So essentially, I cut with the bone scalpel, the lamina, lateral to the dura, so I'm not making contact with the dura, and I'm unroofing it, so that avoids even injuring the nerve.
So this part is removed. This part.
Yeah. So
the top part.
Yeah. So this bone is called the lamina. Okay. So basically, I do an en bloc resection. Okay. So imagine me using kind of a high frequency device to make a clean cut of the bone on both sides, from here through here, and from here through here. And then I kind of free up the bone, and then I unroof it. So technically, there's some soft tissue that connects the bone to the dura down here, and I use a blunt device to sweep it off. So it's a very safe technique, and the one concern we have with these procedures, sometimes there's something called dural tear, where the dura, which is like a balloon, can tear if there's sometimes we have adhesions that connect to the dura or some scar tissue. With this technique, I'm sweeping that off, so the rate of dural tear is minuscule. And even if you had a dural tear, we do a repair. So that's the worst case scenario.
Yes.
So this procedure is safe. Okay. So a laminectomy, in essence, it's a very safe procedure, and patients should have zero concern of paralysis. Surgeons never like to say anything is guaranteed, but logically speaking, if the cord ends here, we're working down here, can't get paralyzed.
Yeah.
So let's just take that thought out of the equation for everyone in general. Okay. Now for you specifically, the only nerve in play was your L5 nerve root, which is this one, because your disc herniation that I wanted to remove was between L4 and L5. So once I took off the lamina, I then saw your nerve root. Now we protect it to the side. My PA holds the nerve root out the way. Then I have direct access to the disc. Okay. The fusion technique that I like to use is called an interbody fusion technique. So essentially, once I've done the unroofing, I've decompressed your canal centrally. Then I need to create a fusion bed and remove the disc that's the worst disc that you have, which for you is L4 and L5. So I protected your nerve root, so now that's out the way. I cut into this disc, I remove as much disc material as I can. Now I have an empty space, okay? Now, this is a different level, but it gives you the same concept. Once I have that empty space, now I have to fill it with something. So this thing here is an interbody graft device, okay? And it's titanium, okay? So, and that's what I use. And surgeons, they use different types of devices, but personally, I found the best fusion rates with titanium. So once I clear out that disc space, I clean off the end plates to give me a nice fusion bed. I put in some bone growth factors. This cage, if you notice, is hollow inside.
Yes.
You see that? All right, so I pack that cage with bone growth materials, and then I put that cage in the space where your disc was, okay? So basically, once I've decompressed you, now I have to stabilize it so you can fuse. So once I remove the disc material, I put in the bone graft material in there, then I put the cage in. Now I've given you a surface where it can fuse and become solid, okay? And then I support that construct by putting pedicle screws into these bones on the side at both levels. And you had a one-level fusion between L4 and L5. And we have x-rays showing exactly what it looked like, okay? So you can see there that you have your interbody graft between L4 and L5, and you have the two pedicle screws supporting the construct, and that allows you to fuse. So there are two parts of the procedure. There's the decompression, and then there's the fusion. Decompression takes the pressure off the nerves, and I also do the discectomy to free up the worst nerve. And then I fuse it by taking out the disc and putting these implant materials in there.
And that stabilizes my back right there.
It stabilizes the segment that I wanted to fuse.
Okay.
So this is showing L5S1, this is just a model. But your fusion, as the X-ray shows, it was between L4 and L5. So that stabilizes the segment that was worse for you, okay? And in you, I chose to fuse L4-5 because you had some instability. And if I only did a decompression, I didn't fuse it, then it'll keep moving, and then you can have another disc herniated. So the best way to eliminate the chance of you having further problems after the decompression was by fusing it. Okay?
Yes.
And how have you felt since surgery?
Oh, it's changed my life.
All right, so
When
tell me the
when
sequence, like how did you feel after a week, 2 weeks?
After, even in the hospital, when they asked me to get up, the first time I got up out of bed, I didn't really need a walker. I didn't need a cane. I got up. My body was straight. My body wasn't twisted to the left like it was. I couldn't stand up before.
Okay.
I couldn't stand up straight before. And, my mother kept saying, well, what's wrong? Go to the chiropractor. Why can't you stand up straight? I couldn't. My body was just turning from the pain and twisting my body where I couldn't stand up straight. It was hard for me to do anything. I couldn't lift anything. Now, it's like I'm going through physical therapy. I'm getting stronger. I'm walking. Never had to walk with a cane. I never had to walk with a walker, except when I left the hospital.
What about the immediate post-op pain? Like how bad was that compared to what you felt before?
Very minute post pain.
And we gave you pain medications to keep you
Yes,
comfortable. So.
yeah, I had pain medications that you gave me, and it pretty much kept everything at bay. I just had to, continue with physical therapy to strengthen my back and get myself stronger.
So what would you say to any patient who was going through what you were going through, who was afraid of surgery? Like what message would you have for them?
Well, I can attest. I can attest that it has changed my life dramatically. I feel like my old self again. I feel like I can do things without calling on my family to come and bring my groceries in the house, which I couldn't do before. I couldn't basically do anything.
Wow.
Yeah. Without being in pain and
Right.
moaning and grunting.
Wow.
And, for somebody who is just as fearful as I was, because for me, that wasn't even in the equation to have a
Right.
surgery at
Yeah.
all.
Right.
But it has changed my life.
That's
I
awesome.
I would do it again, and I would recommend it to anybody who felt that, the pain it doesn't outweigh what your life could be.
Right.
You know, you have to make that sacrifice and say, you know, what do you want for your life? I didn't want to be a vegetable, and I felt like I was basically a vegetable.
Right. And now you have your life back.
And I was wearing the pain on my face.
Right.
My friends noticed it.
Wow.
I had to call people to come help me. Now, you know, I didn't want to be like that. I wanted to be independent.
Right.
I wanted to live my life. I want to travel and, you know, get back to work.
Yeah.
So
Well,
it's been a blessing that my pain specialist referred me to you.
thank you.
I had a very strict talk with him and told him under no circumstances was he to recommend somebody who was going to not do the right thing,
Right.
that I thought for my body.
Right.
I did have another consultation with a doctor who wanted to cut me open from the
Right.
front,
Right.
and that scared me even more.
Right.
I'm like, but my spine is in the back.
Right.
Why would you want to cut me from the
Right.
front? And that even sealed in my head my chances of ever having surgery. I was like, absolutely not.
Right.
No, I'm not having the surgery. And I just, you know, I'll have to deal with the pain. I don't care how bad it is.
Right.
And then when I came to your office with my family and they threw 100 questions at you in
They
2
did.
minutes.
They did. How did I do?
Yes, you did good. Because my mother said, okay, now you have to have the surgery.
Yeah.
I feel comfortable with him doing the surgery.
Good, good. Yeah.
He
they,
laid
they,
everything
they definitely
out.
grilled me. They grilled
Yes,
me.
yes.
Your mom and your brother.
Yes,
Yeah.
yes,
yeah.
they grilled you.
Yeah.
And he said they laid everything out.
Yeah.
You have to have it. And so I was like, well, when can you do it?
Right.
How soon can I get in?
Yeah.
And then you told me that I would have to wait a month because you were booked, and I was like, oh my God, I cannot be in this pain another month,
Right.
you know.
Yeah.
So I just took it easy and had to wait I couldn't wait to have the surgery actually after
Yeah.
speaking to you because
Good.
you answered all of our questions and you did it very professionally and you broke it down. And I didn't feel like I was going to be crippled up after that. And I wasn't.
Right.
And after the surgery, I did have immediate relief. I mean, I couldn't believe the first time I stood up. And I stood straight up. And I'm 6 feet.
Right.
And before I felt like I was 5'9" because
Right.
I was twisted and buckled over from the
Right.
pain. It was astounding to see
And
that.
now you're back to being your fashionable self.
Yes. Yes. I
Well,
even put heels on.
I love it. I love it. Well, there's nothing more gratifying for me than seeing my patients who come in at their wit's end, and I come up with my plan, and I execute my plan, and then we speak post-op, and they do as well as you do. There's nothing that makes me happier in my professional life than that. So,
Yes.
So thank you.
Yes.
Thank you. I love
Thank
it.
you.
make
Thank
my
you
job-
for giving me my life back.
I love it. I love it. I love my job, and this is awesome. So
Yes.
congratulations.
Thank you.
And I look
Thank
forward
you.
to all the exciting things you're gonna do, and hopefully I'll see some pictures from you on the road again very soon.
Yes,
So.
absolutely.
All right.
Thank you.
All right. Thank you so much.